Please welcome to the stage your conference chair, Anita Anand.
Good morning.
Conference in 3 words.
Fun, exciting, vibrant.
Interesting.
I think it's been really inspiring. I've really enjoyed the networking, and I think the messaging's been great from the main tent.
Networking.
If I was to describe conference in 3 words, I think I would say networking, friends and messages.
And information.
In 3 words, I'd describe conference as
energising,
inspiring,
collective,
future thinking, that's 2, isn't it, in one go?
patient focused.
Interesting, exciting, and makes it a 3rd word, doesn't it? So if I said interesting and exciting.
There's a huge amount for us to celebrate, and we should not be backward in celebrating.
So we've managed to be at the conference 10 minutes, and we've mentioned Europe twice now.
You heard Stephen Dorrell, he talked a couple of times about our next speaker.
At the end of the day, complex patients, especially low-income complex patients, oftentimes have social needs that trump their healthcare. If a person with diabetes is living on the street, there's no way for them to manage their disease. Why? Because there's nowhere for them to put their insulin if they're living on the street. And without that insulin, without that ability to manage the disease, guess where they end up? They end up in the emergency room over and over and over again. And in order to address those challenges, we had to take on housing, we have to take on employment, and we have to be willing to see the broader picture and the challenges of the populations we serve.
They'd spent 9 months looking after me in hospital, and as soon as I was home, I was considered well. I wasn't well. I was caught between my old self and my new self with no idea of what I was going to do with myself.
Please put your hands together and welcome the digital doctor, Bob Wachter.
I think it's a really good example of bringing together commissioners, clinical leaders, chief executives and also technologists. And I think historically too many conferences have those as separate groups. And I think the advantage of Confed is really you need to bring those together for us to achieve some of the service transformation that we desperately need.
What's really inspired me is, I work for an IT company, is that digitisation seems to be getting a real high priority. But it's not only digitisation for digitisation's sake, it's all about transformation, and people are beginning to realise, through Bob Wachter and the Wachter Review, that bringing IT into the NHS has got to be accompanied by transformation and change.
I think my favourite aspect of the conference is the opportunity to catch up with colleagues. When you're busy, eyes down, doing the day job, actually the time to stop and think and engage with others is very limited. What Confed does is give you the opportunity to meet colleagues that you already know, but actually plenty of opportunity to meet new ones as well.
Meeting old colleagues, and but actually also getting to meet new people with new ideas.
Favourite part of conference really is to network with colleagues and talk to them from our point of view about how physiotherapy can help solve some of their problems.
For me, the biggest inspiration at conference are the delegates. We're here again, people have enormous challenges, and yet you see happy, smiling people working with colleagues, meeting with colleagues, and actually just spending a lot of time talking about how we can do best for our patients.